All right, good evening, ladies. Hey, welcome to Wellness Wednesday. I hope you guys have all had a wonderful Wednesday, wonderful week so far. I wanted to just shout out, we have reached a fun milestone in the group, and we have reached over 10,000 wonderful ladies in this private Facebook group. And so, welcome to all new ladies who may be jumping on Wellness Wednesday tonight for the first time. So that's exciting. Um, yeah, it's a good time. It's good. We're gonna say my disclaimer real quick while we are waiting for anybody else to jump on. So let's just do that first before I jump into tonight's topic. So anything that I say here tonight is not intended to give you any specific health advice. It is simply health information. Do not start taking or stop taking any of your medication or change the way you're taking any of your medication. Please consult with your prescribing practitioner so that they can help you do so if you feel like should make changes. And by attending this Wellness Wednesday this evening, this does not establish a doctor-patient relationship. So there you go. Now, this topic, uh, we I really wanted to lay some important groundwork for some of what I will be covering in the upcoming master class that will be taking place next month. So it's right around the corner, March 25th through the 29th. I will be sharing so much information with you ladies who attend. I will be, and it is a free master class. It's just right here in the group. Um, I will be sharing my thyroid repair blueprint that has helped so many patients, uh, and fix their thyroid and literally regain their life and their health. So we're going to be talking about why it really isn't all in your head. Okay, why the symptoms you're having mean something and what they mean. Okay, we're going to talk about all about that. I'm going to teach you all the causes of thyroid dysfunction, mostly low thyroid, but I'm also going to touch on hyperthyroid. So those of you who have those kinds of issues as well, this is absolutely the information you need to have. Um, this is a tough thing to bring up, but I'll be teaching you about the broken healthcare system that you are, unfortunately, many of you are in, and and what that means for really discovering what's going on with your health for once, and give you a way to find out, truly find out. So one of the topics that comes up, of course, in this thyroid group is, well, what's Hashimoto's and what does it mean? And although that's not the topic for tonight, because I have done, gosh, at least one Wellness Wednesday on that topic, um, and I cover this extensively in the masterclass. What you do need to know is it is an autoimmune condition, and I'm sure those of you, you know, I'm sure most of you have researched and read about Hashimoto's in your quest to find answers. Um, and so, jumping back real quick to my thought about the master class, you will get so many answers. So be sure to, if you've registered, be sure to show up. Um, Encourage those who could benefit from learning about, or learning all about hypothyroidism. Um, get on there and participate as well. So anyway, that is March 25th through the 29th, and it'll be every evening that week. All right. So tonight, like I said, very important topic, kind of laying the groundwork for talking more about Hashimoto's. We're talking about the immune system tonight. So, what is immunity? What is it that makes up our body's ability to fight off infections and foreign substances? Well, the immune system is made up. There's lymphoid tissue. There's white blood cells. Okay, and so we're going to talk about the different types of white blood cells first. These are comprised of T and B lymphocytes. So lymphocytes are white blood cells. Um, T cells can wipe out infected or cancerous cells. They also control the immune response to threats by helping B cells, B lymphocytes, to eliminate invading pathogens. So um, the bad guys, right? Pathogens are the the little microscopic bad guys that get into our cells. I'm going to go over those too a little bit. And so B cells are the cells, the white blood cells that create antibodies, right? This can provide immediate immune support or long-term immunity to these invaders. Okay, now antibodies. What are those? Antibodies are proteins that protect you when unwanted substances enter your body. Uh, Antibodies bind to these unwanted substances in order to eliminate them from your system. So when they bind to foreign substances, they do three things. One, they neutralize the substance so that it can't act like it normally would to cause the effects, the problems. This happens a lot with viruses. So you have antibodies that neutralize viruses so they don't do their damage, and I'll go over what those do, what viruses do in a little bit. There's also the next thing they do. The second thing is the antibodies activate mechanisms of cellular destruction. So literally, when there's something amiss in the cell, these antibodies will cause that cell, will mark that cell for destruction by the immune system. There is something specific called the complement system. I know this hopefully isn't too boring, but it just is helpful, I think, for you to understand that there's some really interesting, active stuff going on in your body all the time that stresses it out. Antibody production also facilitates, and this is the third thing, immune cells' ability to engulf or eat and destroy the substance. So that's kind of interesting. I mean, if you kind of get that little mental picture in your head. So these antibodies are proteins, and what makes proteins but amino acids? And so when you've got when you've been exposed to so many things, your body it's got so many resources and only so many resources. So when you're dealing with viruses that are that cause more chronic infections, and I'll get to that, this produces a stress on your body's resources and therefore on the immune system. All right. And that stress where your body has to utilize your nutrients that you would normally just use for normal function, then cause, stress to your body, and cortisol rises, the stress hormone, and that interferes with thyroid function, endocrine function in general. You get my point. This I hopefully get my point that we want to support the immune system the best we can so that these stressors, so that it can keep up with this stress, right? So we don't want to overload the immune system, or we don't want to overload uh, the body's ability to fight things off. And so that's one of the purposes of functional medicine, and figuring out what is going on, instead of, well, what band-aid can we prescribe, right, to help you with a symptom. Okay, lymphoid tissues are part of the immune system. Where are they located? So bone marrow is the primary lymphoid tissue. This is where white blood cells are developed, right? So your bone marrow function is super, super important for your immune system. The secondary lymphoid tissue would be in lymph nodes, in the GALT, or the gastrointestinal associated lymphoid tissue, that's right underneath the first layer of your uh, GI tract lining. It's right there with the blood, with the blood supply, with the venous system. Um, there's MALT, M-A-L-T, or mucosal associated lymphoid tissue. So just under your mucous membranes. Of course, most of you might know that your tonsils are a form of that lymphoid tissue. Well, they are lymph nodes, big ones, lymphoid type nodes. Um, they are part of that mucosal associated lymphoid tissue. And this tissue, this secondary lymph tissue, supports maturation, survival, and activation of white blood cells. So many of you may have had lymph nodes swell when or you're wondering, well, what is that? What is that lump? And it's your lymph nodes swelling because they're doing their job to help you fight an infection, and helping your white blood cells to mature, and to activate, so that they can take care of, and make the right antibodies for the invaders. Okay. So that's, the basics. Those are the basics of how your immune system functions. Well, so autoimmunity, what's that? It is characterized by your immune system making antibodies that, remember, they identify foreign substances, pathogens, viruses, proteins that mimic our body's normal proteins. Okay. So, and I say, let's go back and say foreign in quotes, because there are things in our environment that cause things to look foreign, cause our own tissues to look foreign to the immune system. And so it makes antibodies against our own tissues. Again, if you have a protein that mimics our body's normal proteins, like gluten mimics some proteins in the thyroid. Wow, isn't that interesting? That your body then can identify proteins in your thyroid that gluten mimics, and it's going, your body, it's thought that up to 100% of us are gluten sensitive, meaning all of us have some sort of issue with gluten. Hold on one second. And so Hashimoto's causes an attack and destruction from the immune system on the thyroid tissue, largely because of gluten protein mimicry. So that's one reason why this happens. And there are some others that cause things to look abnormal, not only in the thyroid, but in so many other areas of the body. And so autoimmunity is where your own immune system fights against your tissues, your own tissues, because something looks foreign about them, okay, about the specific tissues. All right. And then autoimmunity is also characterized by, well, it's it's made worse by triggers, right? So if we think of these antibodies as tags, the tissues are tagged. It's like this. You go into a store and there's a bunch of products that are marked on sale. Well, they're going to be the first things to sell, right? Because everybody's looking for the sale, right? And so those are going to go first. Well, these tissues and cells and substances in our body that are tagged with these antibodies are going to be the first thing that are destroyed when the immune system is triggered. Okay. So we've got to think about that and think about, well, what are our body's triggers? All right. Then the next point I need to make about the immune system is it can become less functional. Well, why? Well, hypothyroidism can make your immune system less functional because even your white blood cells need thyroid input. Those cells need thyroid hormone to turn on their metabolism. Okay, so if those cells, those white blood cells, aren't turning on their metabolism, they're not going to act right. They're not going to respond as quickly to these invaders. Okay, so hypothyroidism definitely can cause immunodeficiencies. So what about gluten, right? What about foods that, glucose, sugar? What about that? What does it do? Well, we know that these foods, certain foods, are inflammatory and they are irritants, and they cause stress on your body, and so that keeps nutrients away from your white blood cells that, like I said, they need to be activated properly. They need to function properly. And so when we're eating foods that that diminish our nutrition, okay, because they cause inflammation and they cause um, the immune system to go after those, right? Um, there's an inefficiency that's created, a state of inefficiency. And so by and by, the immune system will function less efficiently, and that's bad. Well, bad infections can also decrease immunity. Um, HIV, right? Certain retroviruses cause such problems with the certain immune cells because HIV attacks the B cells directly, the T cells directly. COVID. So we're learning in the research, and I'll get more into this in a bit, but the proteins that this virus produces um, act in a specific way against your immune cells. So uh, it decreases their ability to make the right antibodies. And I should include in that the the shots that also impact the immune system in a way that renders the immune system less functional. And there are other viruses. Epstein-Barr virus is known to cause a lot of immune system dysfunction. Viruses themselves, let me talk a bit about those. Viruses cause acute or cytolytic, meaning They cause cells to burst, okay, type of infections, acute infections. They can cause chronic or steady state infections. So this is more in line with like Epstein-Barr, and this just poses a chronic stress on the immune system because it's constantly producing antibodies uh, to, try to neutralize these viruses, and it's just barely keeping up until something happens and this is reactivated. Okay, then it becomes more of an integrated infection, which is another way the viruses can cause infection, or viruses can cause latent infections. So this is the case like with chickenpox later causing the shingles to erupt, if you will, in your skin. It's because this virus, this herpes virus, lays dormant in a certain area next to your spinal cord, and it gets, because of immune system stress, it would then not be opposed properly, and it reactivates and causes what we call shingles. So this varicella virus is the chickenpox and the shingles virus. All right, so um, these stress viruses, very much these types of latent and chronic virus infections, really do stress the immune system a lot, and they can make you tired. These kind of infections just can wipe you out, cause chronic fatigue syndrome. So it's very important to find out what is going on in your body. All right, I want to talk a little bit about Lyme disease. So Lyme disease is caused by a bacterial infection. It's a bacterial toxin. It's from a bacteria that it's like a little corkscrew-shaped bacteria that burrows into the cell. So it's an intracellular bacteria, and these make toxins, and these, in this way, it evades the immune system, so it stays away from it, and then the immune system really can't do a whole lot about it after only so long. All right, so these bacteria and other bacteria, which I'll talk about next, with MARCoNs, produce toxins. And these toxins also have to be neutralized by antibodies if they can be. They cause cellular destruction. They activate the immune response to break apart cells, and they cause cell death and damage. So MARCoNs is a bacteria that's, well, it stands for multiple antibiotic resistant coagulase negative staph. And this bacteria produces something called biofilm to protect itself. It's the way it actually protects itself from the antibiotic action. And this bacteria produces an endotoxin. And this toxin causes inflammation in your brain because it's neurotoxic. It causes blood vessel inflammation. This can actually lead to cardiovascular disease, because we know that inflammation is what causes cardiovascular disease and heart attacks and strokes, not cholesterol. And so it's very important that we find this. And then let's talk about yeast, because they also produce yeast. Infections will produce biofilms, and that's also to protect themselves from the immune system. And so these biofilms are like plaques, or like it's like a slimy layer that protects it. It's like, I don't know, I remember seeing Ghostbuster and green slime. It's kind of this slimy stuff that covers these, and it protects it. All right, so there are ways to get rid of these biofilms, so that's good. All right, so I mentioned COVID above and COVID before, and I'm going to just get into this a little bit more. Not much, because you know you have to sometimes be careful about what you say. Um, it it is thought to be a virus, and it it was thought not to necessarily be a fully naturally occurring uh, virus, and so what is happening with this is it's it is causing your body to create proteins, spike proteins, that do different things. The spike proteins stick, especially to the endothelial cells in the blood vessels, and they cause a lot of inflammation there. And they also so they start to really um, penetrate, because of how they latch onto the blood vessels. They penetrate everywhere, right? And so this can cause a latent problem. So we call it long COVID. Sorry, not latent, but a chronic or steady state kind of infection. So that's where this long COVID idea comes from, where you're uh, just kind of sick, like low level sick for a long time. Many people they tell me they don't recover after getting sick with COVID. And so it just lasts for so long that it's causing the immune cells, the white blood cells, not to function as well as they need to make the right antibodies, because they're not able to. I don't know. It gets tricky, but the proteins themselves there's a difficult time. The body has a difficult time neutralizing those proteins. Okay, so I want to just say something briefly about a lot of you ladies think that you might might be kind of healthy because you don't get sick too much, but just because you're not getting sick a whole lot doesn't mean your immune system is actually functioning right. Your immune system should actually cause some of these symptoms to get you well, to get rid of these substances from your body. And if you don't have these symptoms, that can be a sign of poor immunity. So don't be fooled. The key to any autoimmune condition is being able to identify the patient's unique triggers and sensitivities, which would be triggers, and develop a customized care plan that is simultaneously that simultaneously addresses all of the triggers, imbalances, causes, etc. Okay, that the patient's that causes the symptoms and disease, right? This requires. Let me say that again. I'm just didn't come out right. You've got to have a customized care plan that simultaneously addresses all the triggers and imbalances and causes of a patient's symptoms and disease. So you've got to have correct and thorough testing, right? That's imperative to be able to understand how to get well. Doctors in the know can help patients do many things to support the immune system and rid the body of the triggers in case of autoimmunity. So you shouldn't lose hope that even though you've got this autoimmune disease, if you have it, or if you have other autoimmune diseases, that they're they're not able to be helped. They are, because if we can identify your unique triggers and treat them simultaneously, you have an excellent chance of getting well. the fire needs to be put out. How do you put a do you kind of just put it out slowly? I mean, when you notice a fire is burning, do you just oh, here, let's throw a little water on it? Or no, we put it out all at once if you can, right? You put it out, as fast as you can. All right. So the idea is a comprehensive approach to diagnosis, meaning finding out what your triggers are. This isn't looking for disease. This is how we really the key to, helping. And I get into this in a lot more detail during the master class and how you really do that. And that's something you just won't want to miss. So, all right, let's see. Let's go. I'm told that there are a few questions, and so I will answer a few questions. First one is, what do you think of Dr. Gundry's idea about supplement recommendation? Well, I know quite a lot about what he says about, what causes inflammation, but to be honest, I don't know a lot about what his supplement recommendations are because I've learned what a lot of patients need through my experience and treating chronic illness for several years. So I don't know about his particular supplements. Second question, do different forms of cancer also contribute to immune stress? Well, yes, absolutely. Especially immune cancers. I didn't get into that in detail, but when you have cancers that impair your body's ability to make white blood cells, or when they're making the wrong types of white blood cells, right? Like with lymphomas. So this certainly, they're not, these cells, these sick cells are perpetuated and they're not able to help you fight off invaders, right? Third, next question. I had EBV and CMV, so these keep stressing my immune system. Yes, Epstein-Barr virus and cytomegalovirus certainly do keep stressing your immune system. And there, like I said, there are things that can be done. It's not super cut and dry. So it's individualized to a person. So that's not going to be part of my answer, but if stay tuned and you'll hopefully find a way to get the help you need. Next question, can you help someone who has Lyme? Absolutely. There is a lot that can be done for Lyme. There are specific protocols that I've discovered and have utilized in countless successful cases of treating Lyme and persistent Lyme, where you don't even necessarily know you had it. And it's not, confirmed by testing because Lyme testing is fraught with inconsistencies. Let's just leave it at that. All right. Are there any other questions? I hope that what I've said has been helpful. It's I mean, I assume it would be, but let me know in the comments if you feel like this was helpful information, because as I do these Wellness Wednesdays and address topics of interest, I definitely want to make sure that they are absolutely relevant topics. So yeah, I will leave it at that, and I look forward to our next Wellness Wednesday, and certainly I'm looking forward to the masterclass coming up again March 25th through 29th, every evening that week, starting at 8 p.m. Mountain Time. And there is one more question. Is Sjogren's considered an autoimmune disease? Yes, it is. And it's characterized by destruction of the mucous membranes because the immune system is attacking the the mucous membrane. So it could be around, the inner parts of your, under your eyelids, your it could be your mouth. Um, could affect some of your GI tract sometimes, but mostly the the mouth. If Marcon's, wait, one more question. If Marcon's is now negative in my sinus, could it also be a systemic issue? Um, probably not necessarily, unless you're still dealing with some of the toxins that it produces, the neurotoxins that it produces. Say you've maybe had um, effects or consequences of that, you know, infection for however long. But um, no, once you get rid of it, then it stops producing those toxins, of course, because it's not there to produce them, and you're, with time, your immune system should be able, as long as you're supporting it correctly, your immune system should be able to take care of that toxin, and it will be certainly less of a stress on you. So, okay. All right, ladies, I will leave it there. Thank you for spending the time with me tonight here. And remember, there are answers. There is hope. And remember that you still have the power to heal. All right. Thanks again for joining me, and have a wonderful evening. And take care.